Good morning. Welcome to the audio lecture for chapters 2 and 3. This is going to be on health information management professionals, and chapter 3 is going to focus on healthcare settings. As a reminder, in addition to the audio lecture, please be sure that you go to the Doc Sharing and look under the tab for lecture notes, so that you can find the PowerPoint slides for chapters 2 and 3. Students are required to yet read the book in addition to the chapter notes. Now with chapter 2, you have a few notes in your PowerPoints. However, there are going to be some additional notes that will coincide with this chapter. I will make sure that I upload those notes into Doc Sharing under the tab for lecture notes, so that you can have them for your purposes of being able to print them and to be able to study from them. So let's begin. Chapter 2 notes. Our very first slide takes us into what we call careers. So basically in this chapter, in chapter 2, we're going to talk about some of the different types of careers that health information management professionals can obtain there, and then we're going to talk about careers that pertain to the health information management department as a whole. So let's begin by first talking about cancer registrars. In every one of these, and I won't read directly from the slides, I'll let you do that. I'm just going to kind of give an overview of every career. In every career and on every slide, I'll basically tell you what their duties are, what type of training is required, what type of credentials or certifications are required, and employment opportunities, meaning places that these individuals can obtain jobs. So our very first one is cancer registrars. These individuals are very important to the health information department in that basically what their job is to report statistical data on cancer patients as it applies to government and healthcare agencies. Basically, the only kind of training they need is college-based training for managing registry systems. They have to be certified as a CTR, which is a certified tumor registrar. And of course, there are several places that they can get job opportunities. They can apply at a cancer registrar facility. They may work in consulting firms and any type of private and government agency. The next career person that we want to talk about are coding and reimbursement specialists. Now, most of you should be familiar with these type of individuals because you do a lot of this or have done a lot of this throughout your career and throughout a lot of your classes. Many of you have taken, or majority of you, or all of you, shall I say, have taken your coding classes or should have taken them by now. So you've gone through the diagnostic coding classes and the procedural coding classes, so you have a good understanding of what a coding and reimbursement specialist does. And basically it's just what their title says. They focus on coding as it applies to the diagnosis and procedural coding. Usually they just have to have some type of college-based training. There are a lot of places that actually do like a year and a half or fast-track trainings where you come in and get everything in a short amount of time. It's a very aggressive type education piece. A lot of places require that reimbursement or coding specialists are certified. If you're looking at the slide, I have 3 different type of certifications listed, and I will tell you that the number one that most facilities like to see is the one that is certification through AHIMA, the American Health Information Management Association. I always tell my reimbursement specialists and even my administrators that want to have certifications as coders, I always make sure that you get your certifications as they apply to physician facilities and hospitals. The more certifications you have, the more job opportunities that you have as well, because a lot of places look for you to have at least multiple certifications in order for you to be able to work in various areas of the department. Now, the next career is health information managers. Basically, these individuals manage the health information department, anything that pertains to medical records, anything that pertains to administrative computer information as it pertains to a patient record. They manage the coding specialist, the reimbursement specialist. So managers have to have a general overview or general knowledge of how diagnosing and procedural coding takes place in order for them to be able to help provide services to the patients. Managers have to have college-based training. Most places want you registered as either a RHIT or RHIA. Okay, so you will actually be certified as a health information technician or an administrator. There are several different places that employment opportunities for managers. I have them listed on the slide. Consulting firms, clinics, physician offices, even insurance agencies will hire health information managers. The next career that we want to talk about is health insurance specialists. Basically, these are individuals that work in the billing department, and their job is to handle anything that is related to claims for health insurance. So that may be in Blue Cross Blue Shield, Medicare, Medicaid, private, commercial, VA, TRICARE, anything pertaining to insurance. These individuals are trained to handle those type of claims. They only have to have like college or vocational based training. They need certifications either in AMBA or ICA, and also the Medical Association of Billers, so the MAB. Now, those are the professional associations associated with that. But these particular associations also offer credentialing or certifications for these individuals. Again, health insurance specialists have a variety of places that they can work, more so the insurance companies. So places like Blue Cross Blue Shield, United Healthcare, they all deal with health-related claims, and health insurance specialists can obtain jobs in those areas. Our next career is health service managers. Basically, these managers, they plan, direct, they supervise anything dealing with the delivery of health care. Now, for these type of individuals, there's a more aggressive degree. You usually have to actually have a master's or a bachelor's degree. Most places prefer a master's. A bachelor's degree is acceptable though, okay? Certifications through the CNHA, and most of them have employment opportunities in hospitals and clinics. Then you have your medical assistants. So medical assistants basically are individuals that can perform both administrative and or clinical tasks. The reason I say and or is because some medical assistants only perform clinical tasks, whereas some may do both, and that's because they've been cross-trained to do both. When I mention administrative tasks as it applies to a medical assistant, we're talking about in reference of front office, not necessarily billing, but most of them can work in the front office. They can help assist with registering patients, greeting patients, taking phone calls, making patients charts, collecting co-pays, co-insurances, and things of that nature. But the 95% of their time should actually be spent doing clinical tasks. And that's basically where they triaging the patient, they're preparing the patient for the physician, they're giving shots. A lot of them are able to give shots. They may go in the lab and run certain tests, or collect specimens and things of that nature. Medical assistants need some kind of college-based training. Some medical assistants actually go through medical assistant school, where they may get a diploma or some other certification in that. Yes, they need to be certified as either a CMA or a RMA. And of course, they have an opportunity to work in both physician offices and physician clinics. Our next career are medical transcriptionists. These individuals are responsible for transcribing dictated reports. These are dictated reports from the physicians. They're to take these reports and make sure that these reports are dictated and prescribed, so in a way that doctors can go back and look at those transcribed reports prior to them going into the patient's chart. They only have to have post-secondary education, and they need to be registered as an RMT, which is a registered medical transcriptionist. Individuals such as medical transcriptionists, they not only can work in hospitals and clinics, but they also have an opportunity to work from home and to be self-employed. So some other careers that I want to talk about. Number one is consultants. Yes, as a health information manager, administrator, coding specialist, you can get a job as a consultant. They're mostly home-based type jobs. Medical office managers, these are individuals that actually manage a physician office or a clinic. So they have to deal with everything pertaining to financial aspects, human resources, risk management, anything that involves the facility as a whole. Medical staff coordinators. These individuals are only responsible for managing the medical staff office. Most of the time, medical staff coordinators usually do a lot for the physicians. They help physicians keep up with their credentialing. They plan trips for the physicians and various other jobs as well. Privacy officers, these are individuals that help with maintenance of and implementation of the organization's policies and procedures as it pertains to patient health information. These are also the individuals that give training for HIPAA and to make sure that all employees are in compliance with the rules and regulations. Then you have a quality manager. A quality manager's job is to ensure that the facility is providing quality patient care. They may do chart audits. A lot of them may just do an overview of the facility as a whole, just to make sure there are no risky things taking place. Like, say for example, you go into a patient room and you may see that it's very unorganized or there's some hazardous things going on. The quality manager's job is to ensure that patients as well as the employees have a safe working environment. Risk managers work closely in hand with the quality manager. Their job is to make sure that any type of potential risk or anything or any type of incident that has happened, their job is to make sure they investigate and analyze that incident, review it to see what other steps or what the next steps need to be that they need to take. Utilization manager's job is to coordinate patient care so that they can make sure that the appropriate utilization of resources, the delivery of healthcare services, discharging, transfers, all of those things are done in a timely manner. Utilization managers stay on top of supplies, ordering, just to make sure that whatever the facility is in need of, they have those things. Their job is to also make sure that patients that are coming to the doctor and being seen, and when they're leaving out, that make sure that their chart is in order, nothing's out of order, everything's in place. Like, say for instance, if they're working in a hospital, they have to make sure that transferring and discharge instructions and stuff are properly documented into a patient's record. Then you have your vendor salespersons. These are the individuals that pretty much go out and get the sales for the facility. They also work a lot in pharmacology. These are like your sales rep that goes out and sell pharmaceutical instrumentation, medical devices, and things of that nature. Now, some other opportunities or other careers that I want to talk about before I kind of mention about different types of certifications for coders and coding specialists is one that I want to talk about is the CIO. This is the Chief Information Officer. The Chief Information Officer. And I know some people may say, oh, what's a Chief Information Officer? And so you may hear these individuals known as CIOs, and basically what they're responsible for is the overall direction of the organization. Okay? They must have knowledge about the workings of the total organization. They have proposed budgets for projects and programs. They make decisions about staff training and equipment purchases. And they hire and assign computer specialists, information technology workers, and support personnel to carry out certain technology-related projects. CIOs manage the work of employees. They help review their output. They establish administrative procedures and policies. And of course, they help provide the organization with the vision to master the different duties or to master the mission in which the organization is headed. Those are the duties of the CIO. They only have to have what we call college-based training, and they need to be certified as a CM, which is a certified manager. Now, these individuals can work in a variety of settings as far as employment opportunities. All right, so the next one I want to talk about is the CKO. This is the Chief Knowledge Officer. So the Chief Knowledge Officer has several duties. They lead the development, management of sharing of knowledge within a healthcare organization. They help to manage the organization's capital, and they serve as the head person of management practices within the organization. They focus a lot on processes, customer relationships, and best practices and ways that the facility can improve on the things that they're doing. They have to have college-based training, and of course, right now there's no specific certification required for a CKO. And again, their opportunities, they can work in a variety of settings. One other career that I want to mention is the CHDA. The CHDA, this is the Certified Health Data Analysis. Certified Health Data Analysis. Basically, their job is to collect data and use that information to help with ways to improve the services within the facility. Okay, so they just go back and they collect data. They may do patient surveys, they may do employee surveys, they may do some research-based information, like if they wanted to collect data on 4 or 5 particular facilities in one area to help them with, ways that they can improve their particular facility, or ways that they can make customer service better. That's pretty much what they do. They just collect data to be able to do those kind of things. They have to have like college-based training. They usually become a part of the Professional Association of HEMA, and of course their certification is actually CHDA. Then you have the CDIP, which is the Certified Documentation Improvement Practitioner. Certified Documentation Improvement Practitioner. So their job is mainly related to medical records, as far as auditing records to make sure documentation is documented properly as it should be in the patient medical record. Most of this kind of stuff is done electronic now. There are really very few places that still have paper charts, because mostly everything now is gone to electronic. Even though that is happening, these individuals still have ways to go in and audit charts and things just to make sure that everything within that patient's record is accurate and completed. They have to have college-based training associated with Professional Association of AHIMA and certified as a CDIP. They can work in a variety of settings. Okay, so the next we have is CHPS. This is Certified in Healthcare Privacy and Security. Healthcare Privacy and Security. So basically their job is to organize and manage privacy and security programs within organizations to protect patient information. That's what their job is. They have to have some college vocational school training, and they also are associated with AHIMA as the professional association, and they have a certification that is actually CHPS, and they can work in a variety of settings. Okay, the next we have is the CHTS, the Certified Healthcare Technology Specialist. So these individuals have the task of assessing information workflows. They're responsible for selecting hardware and software that will be utilized in healthcare facilities. They work closely with vendors. They install and test information systems. They diagnose information technology problems, and they're also the ones that are responsible for training staff on the different technology systems. So they have a variety of things that they do. Their training is through a professional exam. They take a professional exam. They are associated with AHIMA. And of course, they can work in a variety of settings. All right, now the last few slides talk about, it's just a listing of different types of certifications that are given for different types of careers. The very first section that I have listed is the one for professional coders. And of course, you can see the entire list that I have listed up here. And again, these are just different type of certifications. Becoming a coder, this is what I was talking about when I was saying to become, when becoming a coder, you want to try to get multiple certifications if possible. So some of the ones I have listed here: CPC, CPCH, CPCHA, CPCP. As many certifications as you can get, the better. And so I just kind of wanted you to take a look so that you can kind of see what kind of certifications are offered out there for you all as being professional coders. Then you have the American College of Medical Coding Specialists. You have that listing of certifications listed there. There are several certifications related to health information management. Those coding certifications are provided by AHIMA, and they consist of the CCA, the CCS, and the CCSP. Now, some of these coding certifications I had you all to do in one of your activities that you did for a blended day. That was the one about the professional credentialing Well, I had you to go on different websites and learn about those. I did that so that you can be aware, if you have an interest in wanting to get multiple certifications, you will be aware of, how much it will cost, and, how often would you have to keep your CEUs up and things of that nature. So lastly, professional practice experience. That is where you do externship. Externship prepares you for the profession that you're going for. One of the things that you want to be aware of is making sure that you create a professional resume, and it wouldn't hurt to have a cover letter as well. Knowing your student responsibilities when you go on your externship is very important, and then making sure that you stay in compliance with your code of ethics. And when we talk about ethics, we're talking about those things that distinguish between right and wrong. Every professional association has a code of ethics that are to be followed, whether you're a coder, whether you're a manager, whether you're a medical assistant, whether you're a nurse. Every career has a specialized listing of code of ethics. And then for our last slide, encouraging you to join professional associations. That is very important. A lot of time when you become a member of a professional association, you get a lot of different perks. It could be that for an exam you want in a certification, you can get it at a reduced rate. You get an opportunity to get free CEUs if you're required to do so many professional developments throughout the year for your job. When you join a professional association, you get free CEUs, and those will be free credits that you can get, and it may consist of reading magazine articles or attending conferences. And even if it's conferences that you want to attend to stay up to date on a lot of different things, you can usually get those at a reduced rate. But some of the benefits, I have them listed here. Publications, you're able to network with other individuals. I already have it listed here. Reduced certification exam fees. And a lot of professional associations will also give scholarships and grants if you want to go back to school to further your education. So that pretty much concludes the notes for Chapter 2. We're going to move right on into Chapter 3 as we talk about healthcare settings. So in this chapter, we're just going to kind of briefly talk about some of the different type of healthcare settings that you would need to be familiar with as a healthcare administrator or a healthcare manager. Okay, so Chapter 3, healthcare settings. Now, the first thing we want to do is talk about acute care facilities. Okay, so number one, we want to talk about single hospitals versus multiple or multi-hospital systems. So single hospitals are those hospitals that are self-contained and they're not part of any other organization. They're their own entity, whereas multi-hospital systems are 2 or more hospitals that are owned, managed, or leased by a single organization. So I can give you an example of that. When we look at like Trinity Medical Center. So Trinity Medical Center is not branched with any other hospital here in Birmingham. Okay, they're like their own entity. But when you look at somewhere like UAB, UAB is branched off. UAB is branched off into Kirkley. UAB is branched off into UAB Medical West in Bessemer, UAB Urgent Care in Hoover, and they have like different satellite clinics and things of and those type of things. So when that's like an example of what I mean by single hospitals versus multi-hospital systems. Your ancillary services in acute care facilities are your diagnostic and therapeutic. So your diagnostic services are those services that are designed to diagnose the patient, to let the patient know what's going on, whereas your therapeutic services is your treatment that you receive based on the diagnosis. Acute care or short-term care, as it pertains to different facilities, The LOS for them are like 4 to 5 days. And LOS, as a side note, if you want to make it as a side note, that means length of stay. That means long-term, short-term care or acute care. Normally, those individuals are within that hospital setting for like 4 to 5 days. Versus long-term care, they have a length of stay of about 25 days. So what do we mean when we say hospital bed count or bed size? That's basically the number of inpatient beds that's licensed by the state for that particular facility. Every facility is different. Now, every hospital has the same bedside count. It varies from facility to facility. So, of course, your much larger hospitals are going to have the larger bed size. So, what are some different categories of hospitals? One, you have your CAH. These are your critical access hospitals. Most of the time, these hospitals are within 35 miles from main hospitals. You have general hospitals. These are the hospitals that perform general things like general surgery, emergency care, or they just admit patients for different types of problems. So a general hospital will be somewhere like Brookwood Medical Center, St. Vincent's, St. Vincent's East. Specialty hospitals would be places like Spain Rehab, Burn Center at UAB. These are specialized. They're just like a regular hospital, but they're more of a specialized hospital because they take care of special type of conditions of patients. Rehab hospitals admit those patients who usually have some type of trauma and they need to restore them back to life. So you have one in particular, the Lakeshore Rehab facility, and then you have other rehab facilities as well. They're set up like a hospital. They have hospital beds and they have patients that's there short-term, long-term, but their ultimate goal is to help restore those patients back to normal health. Then you have your behavioral health care hospitals, and these are the hospitals that are designed for your mentally ill patients. In hospitals, you have individuals who spend a lot of time at the hospital other than the main physician. We call these individuals hospitalists. They come around to patients' room. They do just about everything that a normal physician would do, except they work under the direction of the main physician, but they're usually the ones that are there most of the time, especially when the primary care provider is unable to come and visit with patients. So now let's talk about some of the different type of hospital patients. So the very first one is you have your ambulatory patients. Always remember that anything ambulatory is usually your outpatients. These are patients that are treated and released the same day, and they usually don't stay overnight. If they stay overnight for about 24 hours, we then call that an observation patient. Ambulatory surgical patients usually undergo surgical procedures in an outpatient setting, and the patient, again, is usually treated and released the same day. Emergency care patients is exactly what it says. You come in, they treat you for acute care. Sometimes, depending on what's going on, you could be released the same day or admitted to the hospital. Then you have inpatients. Any patient that stays in a facility for more than 24 hours and they're provided a room and board and nursing services, we classify them as an inpatient. Newborn patients are your infants that are, they're classified as a newborn right after birth. There are instances in which they may have to receive NICU, neonatal intensive care, and that's usually if they're premature, something's going on with breathing, something didn't develop right, or various things. Observation patients, as I mentioned before, are usually individuals that are there for a limited amount of time for staffing to evaluate their condition, just to make sure everything is okay. Sometimes a person going for a stress test, the doctor may say, oh, well, let's just kind of monitor them for 24 hours just to kind of, make sure everything's okay. Subacute. These are provided, subacute patients are those patients that receive long-term acute care. So those may be chemotherapy, your cancer patients, your injured rehabilitation patients, individuals that are on the ventilator, breathing machine, or those individuals that have to be in wound care settings. Those are called your subacute patients. Now, in your book, there is a table that talks about all of the different types of ambulatory and outpatient care type facilities. So if you look in your book at the table in your book, you're going to be able to see all of those different types of settings. So those settings would include hospital-based outpatient department, emergency department, ambulatory surgery. There's a whole list of them. So that's listed in table 3.1 in your book. And basically what this does is it gives a listing of freestanding hospital-based and hospital-owned ambulatory systems. It tells you the type of facility, the name of the facility, and a brief definition of each one and what type of services they provide. So be sure that you look through those tables, table 3-1, to gather that information. Okay, so the next slide, alternate care facilities. These are also listed under that table. And that's listed in table 3-2. So in table 3-2, different types of behavior care facilities. All of those are listed there for you. It starts with the chemical dependency program. So make sure you go through that table. That's table 3-2 in your book. Then we get down to hospice care. So we know the goal of hospice care and what they're designed to do. Hospice primary goal is to provide palliative rather than curative care. Basically, hospice is used to keep the patient comfortable. Their job is not to extend the patient's life or keep them living longer. They're just to provide comfort care. Okay? So when we talk about palliative care, we're talking about comfort management. When we're talking about curative care, we're talking about therapeutic. And when we're talking about respite care, this is relief and rest to the primary caregiver. So respite care is to allow that time for individuals to come in so that loved ones can go and get them some rest and go and do some things that they need to do. Durable medical equipment. Okay, when we mention the word durable medical equipment, this is equipment that is used to help assist patients for whatever their ailment is. So I have a list on the slide: canes, crutches, hospital beds, walkers, wheelchairs. The list goes on and on and on. This is not everything. This is just a minute list that shows you some of the different types of durable medical equipment that is used in healthcare settings. Then you have your home infusion therapy. Of course, you have chemotherapy for your cancer patients. You have your drug therapy. You have hydration, water therapy, pain management, and then you have your total parenteral nutrition services. All of these are services that are given in healthcare settings. So your drug therapy consists of your antibiotics, or your hydration therapy. Those are where you're getting the IV fluids. This is where patients get the IV fluids, electrolytes, and any other additive that have to be given to them through a tube system. Pain management is actually what it says. It's mainly dealing with narcotics and other drugs that are designed to relieve pain. Pain management occurs when those individuals are watched a little bit more closely. To make sure, because you have to be careful with those kind of things so that you won't have patients abusing the drugs, and especially when it comes to narcotics. Personal care and support services that are given in healthcare settings. This includes different type of, and you see a lot of this in nursing homes or assisted facilities where individuals have to have help, the patients have to have help with bathing and dressing and grooming and going to the toilet. You may have to feed them, different types of recreational services. This is just personal care and support that's given in healthcare settings, depending on what that facility is. You got your long-term care. Long-term care is designed for individuals with disabilities or ailments that have to have rehab services for a significant amount of time. I have some different types of facilities listed on the slide for you. Adult daycare, long-term hospitals, skilled nursing facilities. These are just a few examples. Each one of these are in detail in your book, starting on page 70, and it goes into more detail. I just have them listed here, but like say for instance for long-term care, adult daycare, this is usually for, a lot of times you'll see this in churches, freestanding facilities. They specialize in caring for individuals that have Alzheimer's diseases. Adult daycare staff members usually include an activity director. You usually have a nurse that's there, a social worker, and adult daycare facilities, those type of facilities have a lot of volunteers. And then lastly, you have federal, state, and local health care facilities. One being correctional facilities. These facilities provide inmates with a secure housing environment that also offers vocational and educational advancement. They also get medical, dental, and mental health care services as needed if the inmate has to have that. So an example of that would be the POB, the federal, that's the Bureau of Prisons, which provides medical, dental, and mental health services to inmates that are incarcerated. You have your military health services. This type of service provides health care only for active members and their dependents, and is usually given in a military treatment facility. You have your VHA, which is for your retired veterans. This particular system provides medical, surgical, and rehab care to veterans of the armed services. And then lastly, you have your PHS. This is your public health service. They provide services to help promote the nation's health, understanding, and preventing disease and injuries. All right, so this concludes our notes for chapters 2 and 3. Again, as a reminder, make sure that you go back and read the chapters in their entirety for chapters 2 and 3, and make sure you go back and look at those tables that I mentioned in the notes so that you can have full definitions of the different type of facilities that were mentioned, because they're just only listed in the notes, but they're in greater detail inside of the book. Thank you.